Hi everybody, I am Thatnursingprof and welcome to my channel. In today's video, we're talking about insulin pens. Now I did make a previous video on subcutaneous injections, and in that video I used insulin from a vial and an insulin syringe. But I wanted to make this video about insulin pens because they are becoming more and more common, and so you will absolutely be encountering them in your everyday practice. The patients actually prefer the insulin pen. They like the insulin pen. It's simple, it's just as accurate, and it's a very convenient way to get this medication. The kind of downside of the pen is they are a little bit more expensive. But they are very common, they are very popular, so that's why I wanted to make this video. So let's get into it. Just like with any other medication, right? We're going to check our MAR, do our 3 checks, our 6 rights, check for expiration date, verify the patient with name and date of birth, assess for allergies, provide privacy, and perform hand hygiene. Now we're actually ready to give it. The supplies you're going to need are your insulin pen, an alcohol wipe, and this is the needle. This is the disposable needle. So when you take this part off, I just want you to see there's nothing pointy here, okay? So this isn't sharp, the hub. So you need to attach the needle because that's what's going to inject into the patient. So the alcohol wipe is to wipe this part off because of course this is reusable. So you would wipe it off just like you would wipe off the top of a vial, right? Now to place this on, you're going to take this part off. And don't put your finger in there because that's where the needle is. See it? And then you're going to attach the two. And it's just a little screw in. It's super easy. Screw that part in, and then you'll take that part off. Now this part is still covering the needle, okay? Once you're ready, you have to prime the pen. So you need to take off this part, and you can see the needle there, right? Real tiny. To prime the pen, you want to change the dial to 2, okay? And then you're going to hold the pen upwards and then just click. And you see the insulin coming out. You want to make sure the insulin comes out. So what does priming the pen do? A, it makes sure that the pen is working properly, right? And then it also helps get any air bubbles that might potentially be in there out. It goes back to 0. Now we're ready to actually draw up the amount we're going to give to the patient. So let's say for this example, we're going to be giving the patient 4 units. So what you'll do is you'll turn the knob until it gets to the 4. So here's our patient. Alcohol off the site. And remember, this is the subcutaneous injection, so we're going to pinch the skin. Then we're going to take our insulin pen, inject it, and then you're going to press this button at the top. Ready? So press it, and that injects the 4 units that we wanted to give. Then we're going to wait a couple seconds and remove it from the skin. So now that we've given it, we need to dispose of the needle safely. So the best way to do this is to take the cap that it came with, put it on, twist it off, and then this goes in a closed container, a sharps container. If your patient is doing this at home and they don't have a sharps container, we recommend using something like a coffee can and then putting it in there. So something with the lid, something that is closed. One thing I did want to mention, insulin, even though it comes in this convenient pen form, is still a medication that needs to be signed off by 2 nurses. So when you dial it to whatever number you're giving, you want to make sure that another nurse verifies that that is correct as well. I know sometimes you're like, oh, well, this is a cute little thing, so it's not dangerous. This is a very dangerous medication. So very important that you get this double checked by another nurse before you inject it. A few other things I wanted to mention. When it's a brand new pen that hasn't been used yet, it needs to be refrigerated. Once it has been used, it needs to be kept at room temperature and out of direct sunlight. The American Diabetic Association says that if you keep an insulin pen out of direct sunlight and at room temperature, it can usually last around 28 days. But Every type of insulin is different, every pen is different, so make sure you follow like the specific expiration date and instructions for your pen. If you don't do this, like if you don't store it properly, or if you expose it to direct sunlight, or if it gets too hot or too cold, it can cause changes in the way that the medication works, and that could be very dangerous for our patients. So it's very important that we do store this stuff properly. One final thing I wanted to mention is when we store the pen, don't store it with the needle attached. It doesn't matter if like it's the old needle that you've just used, or if it's like you're prepping it for later and you put a new needle on. They don't recommend storing the pen with a needle attached because it could affect sterility. So that's just one more thing I wanted to mention. So that was my video. I hope you found this helpful. Don't forget to like and subscribe. If you have any questions or comments, please let me know. And if not, I'll see you on the next one.